Hi, Chris Duncan here again, independent insurance broker. And today's video is on an article that I found by Robert King on fiercehealthcare.com. I'm always searching the internet for information to keep us and our clients up to date about changes in Medicare. And of course, I will be providing a link to the article in the description of this video and also in the connecting blog post as well. And Mr. King's article is titled CMS, which stands for Center for Medicare and Medicaid Services. CMS impending overhaul of the Stark Law can only go so far, experts say. And before we get into the article, we first need to learn what Stark Law is. First, it is officially known as the Physician Self-Referral Law. And a link is also provided in the description and the blog post to the official House of Representatives website for you to review the entire law if you wish. So what is the Physician Self-Referral Law, also known as Stark Law? I found the best answer on the official website of the Office of Inspector General for Health and Human Services. It states that this law is one of the 5 most important federal fraud and abuse laws. These laws include the False Claims Act, anti-kickback statute, the exclusion authorities, the civil monetary penalties law, and the one we'll be discussing, the Physician Self-Referral Law. Now, the Office of Inspector General website states the law prohibits physicians from referring patients to receive designated health services payable by Medicare or Medicaid from entities with which the physician or an immediate family member has a financial relationship unless an exception applies. It goes on to state financial relationships include both ownership investment interests and compensation agreements. The Office of Inspector General website also gives an example. If you invest in an imaging center, the Stark Law requires the resulting financial hardship to fit within an exception, or you may not refer patients to the facility and the entity may not bill for the referred imaging services. The way I interpret this is if you are a physician and need to refer a patient for another service, you may not refer it to a service with which you have a financial interest. And if a physician needs to refer someone for an MRI, the physician may not refer them to a facility that does MRIs that the physician or a family member has a financial interest in. And the Office of Inspector General describes some of these designated health services as being clinical laboratory services, physical and occupational therapy, radiology, radiation therapy, durable medical equipment, which is usually our oxygen and wheelchairs, orthotics, prosthetic devices, home health services, outpatient prescription drugs, and inpatient and outpatient hospital services. What if a physician violates the law? What are the penalties? And the penalties for violating the Physician Self-Referral Law are up to $15,000 per violation of the law. In addition, penalties of up to $100,000 for circumvention schemes between physicians or entities entering into arrangements may be levied as well. Last, physicians and entities may be excluded from participating in the Medicare and Medicaid programs. And the Stark Law is what is called a strict liability statute. And a strict liability statute does not require a specific intent to violate the law, meaning violating the law unintentionally or without knowledge does not excuse the violating party from the liability. And now that we know a little more about the Physician Self-Referral Law, let's get into Robert King's article from fiercehealthcare.com. And again, the article is titled CMS's Impending Overhaul of the Stark Law Can Only Go So Far, Experts Say. And King writes the healthcare industry has been pressing the Trump administration to overhaul the Stark Law. Now, how would changing the law benefit Medicare beneficiaries? King writes that the healthcare industry wants CMS to adopt new regulations on Stark because the law has had a chilling effect on participation in value-based agreements. And King's article does not mention what a value-based payment is, but the Centers for Medicare and Medicaid Services website provides a definition and why the Centers for Medicare and Medicaid Services says they are important. The CMS website states value-based programs reward healthcare providers with incentive payments for the quality of care they give to people with Medicare. These programs are part of a larger quality strategy to reform how healthcare is delivered and paid for. Value-based programs also support our three-part aim, and those are better care for individuals, better health for populations with lower cost. And CMS's value-based programs are important because they're helping CMS move toward paying providers based on the quality rather than the quantity of care they give patients. So why should Medicare care if physicians are self-referring? Allowing a physician to self-refer to an organization that they have a financial interest in can obviously lead to fraud, waste, and abuse of Medicare. For example, if a physician has a financial interest in an MRI company like we were talking about, the physician might be more inclined to refer a patient for an MRI that may not be medically necessary. On the other hand, the same physician might be able to provide faster service to their patients by being able to self-refer them to an entity they have more control over. And to keep with the example of the physician with the financial interest in the MRI scanning company, by being able to self-refer to their company, this may allow their patients to get services faster and provide a higher quality of health care. And how many times have we heard stories from our friends and families of having to wait long periods of time for referrals to specialists for specific procedures? Now, King also quotes attorneys on why to change the law and what would actually change. And King quotes in his article an attorney, Andrew Walkler, an attorney and partner with the law firm Walkler and Associates. And he states, it thwarts the creativity necessary and risk to implement some of these value-based systems and quality incentives that are going to be integral into what we expect to see in the future. King also writes that most likely change that CMS can make to Stark is via exceptions. King also goes on to quote Charles Oppenheim, a partner at the law firm Hooper, Lundy & Bookman, and the author of the American Health Law Association's Stark Guide. And he states, if they think it is appropriate and they can craft an exception that people think is useful and workable, that has broad application but also protects against abuse, then they could do that. King next states, but industry stakeholders hoping for a broad exception could be disappointed, and quotes Oppenheimer again as saying, people are always going to be looking for the broadest possible exception to use, and CMS is always going to be nervous and put in safeguards. What is the likelihood of Stark law actually changing? King reports Stark reform does not have much momentum with Congress, and he also writes lawmakers in prior congressional sessions have introduced bills to adopt reforms, but in the latest Congress, most attention has been on drug prices and surprise billing. Lee Little, a partner with the law firm Hamill Little in Atlanta, is quoted by King as saying, I would anticipate the law would remain complex, and I would anticipate it will continue to be daunting. But hopefully the changes that will be made will be clear and uniform so that they can open up the opportunity for individual physician groups to participate in value-based care as meaningful as hospitals and health systems. So in conclusion, as we know, almost every aspect of Medicare is confusing, and the Physician Self-Referral Law is no exception. So the need for oversight with physicians self-referring is certainly evident. And the reason the law isn't in effect is to protect against fraud, waste, and abuse of Medicare. Again, I'm Chris Duncan, independent insurance broker, and we're always looking for information to keep us and our clients up to date about changes to Medicare, and the Physician Self-Referral Law is just one law that we find interesting and important about Medicare. And remember, we are independent insurance brokers, and we help people every day with their Medicare choices for Medicare supplements, Medicare Advantage, prescription drug plans, and their overall retirement needs. And because we're independent, we're able to give you an overall objective view of all the companies and plans available to make sure you're getting the right plan for yourself at the best price. And if you found this info helpful, please do me a favor and click the thumbs up button and leave a comment about our video or ask any questions that you like. Also, please subscribe to our channel as well. This lets YouTube know we are doing a good job. Thank you for watching, and remember, all of our services are always free, and we can be reached directly at 800-910-3382. Thanks again.